Hello, everybody, and welcome to Tuesday edition of Video Clips. This video is brought to you by and sponsored by Wellness Forum Health and the Wellness Forum Institute for Health Studies. First of all, it's my birthday today. I'm 67 years old. I still have the energy of people a third my age, and I do more work than any three people in a given week. And I have plenty of energy to do all of that. So if you want to know how to do this and how to fit it all in, join my Optimal Health and Life with Pam weekend, which is coming up. Only teach it once a year, only 25 people allowed to be in these sessions. I do record it in case you can't join us live, but it's everything from how to manage your time to issues like sleep and supplements and sunshine and intermittent fasting and the right diet and the debate about diet and all that sort of thing, all going to be covered in a boot camp type fashion. So if you want to learn how to be an energetic, healthy 67 years old when you get to that place, if you're not already there, and live to be 100, because that's my plan, you can learn from me on those occasions. A couple of announcements. We have one more spot in the yoga class that starts tomorrow, the virtual yoga class that starts tomorrow. If you're interested, let me know. We'll take your pledge cards. You guys are frantically emailing me. Turn your pledge cards in. I mean, I don't want to be doing this at New Year's, but if you've signed up to send one in, send it in, and we'll make sure that you get your free gifts. And yes, you can use it for conference if you are wanting to attend our conference, which is coming up in just a few days. And it's going to be exciting, lots of great speakers. We'll be sending out the schedule very soon. And if you can't join us live, do it, because we're going to do something kind of fun. Since it's virtual, we'll try and do something different to make this better. And that's going to be flash sales where you can get deep discounts on things, but you have to be ready to act because they're real short periods of time. And some of our really great stuff you can get at quite a discount. So anyway, pampopper@msn.com is my email address if any of that stuff interests you. So I want to talk about depression and anxiety and what to do about it with, I think, some encouraging information. According to a new study, running works just as well for relieving depression and anxiety as drugs. Researchers partially randomized 141 patients with depression or anxiety disorder to either an antidepressant, Lexapro or Zoloft, or group-based running therapy 2 to 3 times per week for 16 weeks. Baseline mental health and symptom severity and physical health were evaluated at baseline. And then at the end of the 16-week period, 45 of the patients took meds and 96 underwent the running therapy. Now, there was a big difference in the size of the groups because some of the patients said they did not want to be randomized and they specifically wanted to be part of the running group. So that may have skewed the outcomes a little bit. But to me, I think one of the reasons why that may have happened is that more and more people are figuring out that these drugs are pretty terrible. I'll circle back around to that toward the end of this. Well, running resulted in a small but statistically insignificant greater remission rate for depression and anxiety than drugs. But there were really big differences in other markers of health. Runners fared better on weight loss, waist circumference, systolic and diastolic blood pressure, heart rate, and heart rate variability. The subjects taking drugs showed deterioration in these metrics, and that's one of the problems with the drugs. They have horrific side effects. Now, the study is not an outlier in showing that exercise works as well or better than antidepressants. First, research shows that just inactivity is associated with higher risk of psychological disorders, and that exercise improves mental health overall, not just depression. This is not new information. Case reports published in the early 1900s showed that moderately intense exercise improved depression and mood. So it's not like we haven't known about it for a long time. Research also shows that almost any type of exercise will do. In one study, 90 patients were randomized to aerobic exercise, which was running or just brisk fast walking, or strength training, relaxation, or flexibility exercise. We might call that yoga. After 60-minute sessions, 3 times a week for 8 weeks, both groups experienced the same level of improvement in their symptoms. This study that I talked about earlier is also not the only one that looked at the comparison between exercise and drugs for mental health improvement. A 1999 study randomized 156 patients to exercise, Zoloft, or exercise plus Zoloft. Medication worked more quickly, but at 16 weeks, there was no difference, and people in all groups were better. 10 months later, however, patients in the exercise group were significantly less depressed than those in the medical or combination group. So exercise is almost dead even with drugs at a certain point in time, but then it goes far ahead of drugs over a longer period of time. Well, in addition to the fact that exercise is effective for reducing or eliminating depression, it doesn't have the negative side effects associated with the drugs, which are really horrific. Side effects of Zoloft include, and this is a short list, it's much longer if you go online to look: nausea, diarrhea, loss of appetite, nosebleeds, increased sweating, fatigue, insomnia, anxiety, loss of bladder control. That would be really fun. Tremors, agitation, and sexual dysfunction. Side effects of Lexapro include a black box warning reporting that the drug can cause suicidal thoughts in pediatric patients and young adults, and then diarrhea, drowsiness, headache, insomnia, nausea, constipation, dizziness, dyspepsia, and decreased libido. Diet and lifestyle changes combined with effective mental health therapy are the best options for addressing depression and anxiety. The drugs really were developed based on the false assumption that chemical imbalances in the brain cause psychological disorders, and that's why a drug, medicinal or drug-based therapy would work. But this isn't true. Taking the drugs will cause chemical imbalances in the brain that make them incredibly difficult to withdraw from. Long-term users, particularly those that have graduated to taking more than one drug, sometimes it takes years for them to completely discontinue these very ineffective and dangerous medications. So all in all, when you look at the risks of the drugs and the lack of efficacy over time, and the efficacy for diet and lifestyle change, great argument can be made that the latter is the better choice. It's always the better choice. No drugs is the best choice, and only when really needed and there's no other alternative is when you take them. One other thing I'll mention to you is the ADHD boot camp that I'm also presenting in November. That's a topic I wanted to do a deep dive into, everything from the behavioral aspects of it to the promise or lack thereof of supplements, that kind of thing. So lots of great stuff coming up soon. I hope you're going to join us for some of it. And so that's it for today. As usual, pass this on to anybody who you think would enjoy watching it. And I'll be back to you tomorrow with more news.